Bismillahirrahmanirrahim. Assalamu alaikum. Dr.S.M.Zafeer with you, and you are watching my informative YouTube channel. Now we are in the flu season. How to minimize the flu infections? Stay with me. If you like this video, please subscribe, like, and share.
The virus A, B, and C are the main infective agents that cause influenza. During periods of cooler temperature, influenza cases increase roughly 10 times or more. Influenza A is the most common type of flu. It accounts for approximately 75% of total flu virus infections, and it is the most likely cause of the seasonal flu that hits the US every winter and in other parts of the world. The influenza A virus is highly contagious. It can spread through tiny droplets of body fluid from coughing, sneezing, or talking. Someone may even catch the flu by touching their mouth or nose after coming into contact with a surface or object that has the virus on it. The Centers for Disease Control and Prevention (CDC) has been tracking flu activity in the United States since 1982. Their data shows that over the past 36 years, February is the most common month for peak flu activity, followed by December, January, and March. While influenza viruses spread year-round, flu is most common during the fall and winter months. Peak levels generally occur between late December and early March. There are many different strains of flu, and they tend to change each year. That's why every year new flu vaccines are manufactured. We can avoid the seasonal flu by getting vaccinated every year. Most experts believe that flu viruses spread mainly by tiny droplets. When people with flu cough, sneeze, or talk, these droplets can go in the mouths or noses of people who are nearby. Flu typically follows this pattern. Days 1 to 3, sudden appearance of fever, headache, muscle pain and weakness, dry cough, sore throat, and sometimes a stuffy nose. Day 4, fever and muscle aches decrease. Day 8, symptoms decrease. Generally, people who have flu often feel some or all of these symptoms: fever or feeling feverish, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. For most healthy people, the flu is an uncomfortable but short-term illness that resolves itself as the immune system fights it off. Symptoms usually appear from 1 to 4 days after exposure to the virus, and they last 5 to 7 days. Uncomplicated influenza signs and symptoms typically resolves after 3 to 7 days for the majority of people. Although cough and malaise can persist for more than 2 weeks, especially in elderly people and those with chronic lung disease. Most flu symptoms resolve within 1 or 2 weeks. Important to note, if your flu symptoms start to get better and then get rapidly worse or don't subside after 2 weeks, contact your doctor. How quickly you recover from a cold or the flu depends on how healthy you are. In general, healthy people usually get over a cold in 7 to 10 days. Flu symptoms, including fever, should go away after about 5 days, but you may still have a cough and feel weak a few days longer. CDC recommends that you stay home for at least 24 hours after your fever is gone, except to get medical care or for other necessities. Your fever should be gone without the use of a fever-reducing medicine. Stay away from others as much as possible to keep from making others sick. Now, how to fight with the flu? The measures I am going to tell you may help ease your symptoms. Number one, drink plenty of liquids. Number two, choose water, juice, and warm soups to prevent dehydration. Number three, rest. Get more sleep to help your immune system fight infection. Number four, consider pain relievers. Tips to ease flu symptoms. Number one is stay home and get plenty of rest. Number two, drink plenty of fluids. Number three, treat pain and fever with paracetamol or ibuprofen. Number four, take care of your cough. Number five, sit in a steamy bathroom. Number six, run the humidifier. Number seven, try a lozenge. Number eight, get salty steam inhalation. Broth. Whether you prefer chicken, beef, or vegetable, broth is one of the best things you can eat when you have the flu. Chicken soup is traditionally thought of as go-to food when you are feeling sick. You can try garlic, yogurt, vitamin C containing fruits and vegetables, leafy greens vegetables, broccoli, and oatmeal. Water is the best fluid to drink when you have a cold or flu, as it helps lubricate the mucous membrane of the throat. Other fluids which are good options during cold and flu infection include juice, ginger ale, herbal tea, honey and lemon tea, mix lemon and honey with a cup of hot water, ginger tea. Overall, reported flu and cold symptoms in the test group decreased 85% compared with the control group after the administration of megadose of vitamin C. Orange juice, especially with the pulp, is packed with vitamin C and folic acid, which may give your immune system a boost and help you feel better faster. Bananas are great for the flu and are loaded with nutrients and energy. They are easy on the stomach. Flu vaccinations are used to diminish the effects of the flu season and can lower an individual's risk of getting the flu by about half.
Protect yourself and protect others. Use masks when you are sick. Prevention is better than cure.
5 ways to fight the flu. Number one, get the flu vaccine. It is the best way to protect yourself against the flu. Number two, wash your hands well and often. Number three, steer clear of someone who is sick, coughing, sneezing. Number four, cough or sneeze into a tissue or your elbow, not into your hands. Number five, stay home if you have the flu. A warm bath can help relieve cold and flu symptoms. A hot soak in a home bathtub will assist in relaxing aching muscles, breaking a fever, and offering some relief to congestion in the chest and sinuses especially. If you notice flu symptoms early, ask your doctor about an antiviral drug like Tamiflu. It is not a cure, but it can shorten your duration. So, what is the take home message when your family has flu? Number one, avoid close contact with the people who are sick. Number two, stay home when you are sick. Number three, cover your mouth and nose. Number four, clean your hands. Number five, avoid touching your eyes, nose, or mouth. Number six, practice other good health habits. Number seven, children who get flu like symptoms at school should go home and stay home until at least 24 hours after they no longer have a fever or signs of a fever without the use of fever reducing medicine. Number 8, those who have emergency warning signs should get immediate medical care. Number 9, yearly flu shot. Thank you very much. Stay blessed.
This video was recorded during my flu. Alhamdulillah, now I am recovering. Please take flu vaccine every year, preferably in the month of September or October.